a farmer and grown up in a farming setup, I can say I've seen soil degrade, lose its value.
Without the illegal levels of air pollution, not only would Ella not have got asthma, she wouldn't have died on that fatal night.
More than 1 billion people today are served by healthcare facilities with unreliable electricity supply or with no electricity access at all.
Suite aux pannes récurrentes des générateurs, on avait beaucoup plus de problèmes dans la continuité des soins parce que l'électricité n'était juste que par intermittence.
Climate change is costing us a lot, both economically and in health terms.
The 1.5-degree target of the Paris Agreement through proactive climate action will significantly reduce food insecurity.
Reliable electricity in healthcare facility make the difference, can make the difference between life and death.
So it is a no-brainer that cleaning up the air and reducing PM 2.5 is where we all need to go.
Hello, everybody, and welcome to the launch of the 2023 report on the Lancet Countdown on health and climate change. It's lovely to be here today. I'm Tulip Mazumdar. I'm the BBC's global health correspondent, and I'll be taking you through the next couple of hours as we take a deeper dive into this crucial area of global health. As this report makes very clear, and we'll hear from many of our speakers today, the climate crisis is a health crisis. So where are we now? Where are we going? And how can we look forward to a healthier and equal future? These are the areas we'll be getting into this afternoon with you. We'll be speaking to keynote speakers, authors of the report, and an expert panel with lots of time as well for your questions. So do have a think and get in touch. I'll be telling you how to very shortly. Let's get through a little bit of housekeeping first. This event is being recorded, and the recording will be made available on this same platform after the event. You'll see we're using this lovely interactive platform today. So let's just have a quick tour. First, at the bottom of your screen are multiple tools you can use. So, for example, if you want to ask a question or you want to read the bios for all the different people speaking, you can do that there. We've got reaction buttons too, so you can make use of those as well. And if you hear a point you agree with, or you just want to give the speakers some encouragement, you can do that all there as well. Second, all the different elements you see on screen are very handily resizable and movable. So you're welcome to just move things around to where you like them to get the most out of your monitor space. We've put this video of the speaker in the middle. But if you want to make space for other elements and progress through the event, you can do that. And you can expand and shrink boxes by clicking on the arrows in the top right corner. If you do have any questions, we really would love to hear from you. We want this to be a really interactive event and get lots of your thoughts and questions. You can submit your questions through the Q&A box, which you'll be able to see on here as well. The panelists and the people here will try and answer those during the event. But if they can't, they can make sure they email you with some answers, but do be reassured that we are capturing all of your questions and insights. We also have a box of related links. So if you'd like to access the full report or visit the Lancet, you can visit the Lancet Countdown website, and that box will show you the way. A little note on internet connection. Events are bandwidth sensitive, so if you close anything that you don't need, any programs or browsers, that will help you keep a stable connection. And you can find any additional answers to any technical issues you might be having in the help tool at the bottom of the screen. Lastly, as I say, we want this to be very interactive. We want to hear from you. So we're using the hashtag Lancet Climate 23. So if you're on social media and you want to get involved, you want to post about what you're hearing, you can use that hashtag and we can connect with you on there. Now, as I'm sure I don't need to explain to most of you here, this report is landing in a year of record-breaking extreme weather events in every single continent, deadly heat waves, floods and fires. And it's now virtually certain that 2023 will be the warmest year on record. I have seen for myself the devastating impact of these types of events. I remember in particularly reporting from the Philippines after Typhoon Haiyan. I remember going there and just seeing communities flattened in a matter of hours. Aid workers couldn't get to these very remote areas for days, so people were left without any help, food, water. There was then the concerns around the spread of disease. I remember seeing bodies laying in the rubble. And one night in particular, I spent with some children. We were all sort of huddled in a tent as the wind and the rain were lashing the area, and the kind of tarpaulin we were underneath. And I remember crouching down with this young girl. She must have been sort of eight or 9 years old, and she was sobbing, and she was just saying, "Make the rain stop, I'm scared." And again, as we all know, as is mostly the case, it was the poorest that were the worst affected. But as this outline reports, there is so much that can be done to better protect ourselves, the planet, and those that are most at risk of the negative impacts of climate change. So let's hear our opening remarks from the Right Honourable Helen Clark, who many of you will know as the former Prime Minister of New Zealand and former head of the UN Development Programme. Helen is also the chair of the Lancet Countdown High-Level Advisory Board, where she plays a crucial role in shaping the strategy of the Lancet Countdown. She's been a long-time advocate for climate action for health, and we can hear from her now.
Thank you very much, Tulip, and many thanks to all the contributors, authors and panellists for today's launch of the 2023 Lancet Countdown report. Let me set the scene for today's launch. Over the last year, we've seen the devastation of climate change around the world. Record heat waves, droughts, floods, and extreme storms have claimed lives and livelihoods worldwide. My own country, New Zealand, experienced shocking storm events last summer, which led to loss of life, loss of homes, community infrastructure, and livelihoods, and to significant disruption to transport and other sectors. As we know, it's always the most vulnerable and marginalised people and countries who pay the highest price for climate change. Yet they are also those who've contributed the very least to the problem. Women, children and adolescents are among those who will continue to bear the most severe consequences of climate change due to unique vulnerabilities across the life course. Each year, the Lancet Countdown has been recording the rapidly growing health impacts of climate change and calling out the delay by decision makers in taking life-saving action. The consequences of that delay include more ill health, loss of livelihoods, and loss of life around the world. I'm told, for example, by the Partnership for Maternal, Newborn and Child Health, which I also chair, that under current emission reduction pledges scenarios, a person born in 2020 will experience anywhere between a 2 to 7-fold increase in weather events compared to people born in the 1960s. The Lancet Countdown was originally established to monitor progress on the delivery of commitments made under the Paris Agreement on climate change, an agreement which the World Health Organization has described as potentially the most important public health treaty of the century. Today's update from climate and health experts suggests that even the devastation from climate change, which we are now experiencing, could be just a first glimpse into an increasingly dangerous future. The Lancet Countdown works tirelessly to produce these annual reports in the hope that they will be a catalyst for climate action, and in the belief that the world can still change course and address the climate crisis decisively. So, as we watch and participate in the event today, I challenge all of us to think about how we can apply the evidence with which we're being presented to taking action. Many of you joining today are members of the health community, for whom protecting lives is paramount. That's why we're all here. As we prepare for what will be the first ever Health Day later this month at a climate change conference of parties, the health community must lead there with rigor, integrity, and ambition to guide the way forward to literally life-saving interventions to tackle climate change. Decisions made at COP28 need to be informed by evidence and commitment to meeting the health rights and needs of those most affected by climate change, including women, children, and adolescents. The road we are on is long, and the hills are rather steep. But with the power of our collective action, we can make a real difference. The evidence of this year's annual Lancet Countdown report has informed developing 11 key priorities to deliver a healthy future for all. This will require the committed effort and cooperation of health professionals, policymakers, financial institutions, our governments, civil society, and the private sector, all working to deliver desperately needed transformative climate action and to enable a sustainable future for all of us. So I now hand over to my colleagues, and I invite all of us to keep in mind that transformative, life-saving action is possible with will and determination. Thank you.
Thank you very much to Helen, the Right Honourable Helen Clark there, outlining just how high the stakes are, but also what you, me, us, we can do in the global health community to make sure that climate and health are prioritised in whatever country we're in, and how key good, solid science and evidence is in making these crucial policy decisions. Let's now hear from our first keynote speaker, the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, who has described what he calls addiction to fossil fuels. From a health perspective, he says it's an act of self-sabotage. Over to you, Dr. Tedros.
The Right Honorable Helen Clark, Christiana Figueres, Dr. Marina Romanello, Dr. Richard Horton, dear colleagues and friends. This year's Lancet Countdown report highlights how the health impacts of climate change are increasing globally, costing lives and livelihoods. The climate crisis is escalating the severity of extreme weather events, increasing food insecurity, exacerbating respiratory diseases, and fueling the spread of infectious diseases. The world is moving in the wrong direction, unable to curb its addiction to fossil fuels and leaving vulnerable communities behind in the much-needed energy transition. Achieving the Paris Agreement target to limit global warming to 1.5 degrees Celsius is a public health imperative. WHO joins the report's call for transformative action to reduce air pollution and increase health equity. We must phase out fossil fuels in favor of clean and renewable energy and invest in sustainable climate-resilient health, food and water and sanitation systems for all. WHO is delighted to be a key contributor to the Lancet Countdown reports. I look forward to COP28 in the United Arab Emirates next month, which for the first time will include a day dedicated to health. Together, we must continue to remind the world that the climate crisis is a health crisis. I thank you.
Very clear messages there from the Director General of the World Health Organization. Thank you, Dr. Tedros. The world is moving in the wrong direction, he said, and we urgently need to wean ourselves off this addiction we have to fossil fuels. These are themes I think will come across again and again in this afternoon's, the next couple of hours that we have together. And a reminder of the hashtag for anyone who's posting on social media. If you have any thoughts on what you've heard from Dr. Tedros or Helen Clark, we again would love to hear from you. Hashtag Lancet Climate 23. Please do send in your thoughts and any questions you might have as well in the box and also on social media. So we've heard from a couple of speakers there who have really set the scene for us and highlighted just how high the stakes are. Let's get into the report itself now. Dr. Marina Romanello is the Lancet Countdown Executive Director, and this year she's brought together 114 academics from 52 institutions to deliver the 2023 Lancet Countdown report, which underscores just how important it is to have a health-centred response in a world facing irreversible harms. Please welcome Marina.
Thank you so much, Judith, for that kind introduction. And thank you so much to Helen, to Dr. Tedros for those keynote remarks and those energizing remarks as well. I'm the Executive Director for the Lancet Countdown, and I'm going to share with you today some of the key findings of our latest report, which you hope you can now see on screen. I'm going to share with you some findings, some of the latest numbers. Bear in mind, this is a very data-intensive presentation, so you might want to enlarge your screen to get a full overview. So the report, the 2023 report of the Lancet Countdown, called The Imperative for Health-Centered Response Towards Facing Irreversible Harms, was launched just very recently, a few hours ago. And it shows the latest findings from this enormous collaboration, which is producing iterative findings year on year to understand better the links between health and climate change. But before delving into the findings of our latest report, I want to share with you some of the numbers that you won't find in the report, but underpin our findings. This year, we have a new regional section in our report. This regional section was put together looking into our findings from a regional perspective, what happens in different continents, in different world regions, and drawing from the expertise of the Lancet Countdown's regional centers and partners from all around the world. I will not share the findings from this regional section today, but you will be able to hear a lot more about that and learn the inequalities that underpin climate change impacts and our actions to tackle climate change in the regional events that will follow this global launch of the Lancet Countdown, and that you will hear a bit more about at the end of this event. We have this year 6 new indicators that allow us to now better understand the influence of climate change on the impacts that we're seeing and the barriers and enablers of our response. And this year's report is the product of 8 years of iterative improvement, 8 years of work to better finesse our understanding of the impacts of climate change on health and of the health opportunities of our climate response. For the first time this year as well, we have looked holistically to all our findings, and we have produced 11 core priorities to deliver a thriving future for all. These core priorities you can find in panel number 1 of our report, and I invite you to look at it in more detail, and we'll share some of the main takeaways at the end of this presentation. And this year we have 47 indicators, giving the most comprehensive assessment yet of the links between climate change and health. But perhaps the most important number of them all has to do with the 114 leading researchers from 52 UN agencies and leading academic institutions of all around the world that contributed to producing the findings that I'm going to share in a moment, with the firm conviction that through a climate lens, we can tackle climate change and still deliver a thriving future for all of us. So the first finding in this year's report, you will not be surprised to hear. Today, at 1.14 degrees Celsius of global mean temperature rise, climate change is increasingly claiming lives and livelihoods all around the world. The impacts, when they have to do with loss of lives, with ill health, are often irreversible. And those that contributed the least to global emissions are, once again, we find, still being hit the hardest. With climate change, global mean temperatures are rising. We're increasingly exposed to extreme heat. And extreme heat is particularly dangerous, especially for elderly populations, populations living with underlying health conditions, heart disease, lung disease, kidney disease, pregnant women and their unborn child, very young children, and those with neurological conditions. We know that it affects physical and mental health, and we know that it leads to an enormous burden of disease and of death. In this year's report, our modeling estimates that the death of adults over 65 years of age has increased by 85% since the 90s. And with a new analysis, we now know that this is more than twice the level of increase that we would have expected if temperatures hadn't changed. So we know that climate change is a big driver behind the increase in heat-related mortality that we're experiencing. And besides leading to an increase in morbidity and mortality, climate change is also, through high temperatures, undermining our livelihoods. In 2022, we saw that with new data from the International Labour Organization, that we had more than 26% of the working age population that worked outdoors, that were exposed to the elements and exposed to the weather that is rapidly changing. And exposure to extreme heat puts these workers at risk. It's an acute hazard to their health. But it also limits their labor capacity. It restricts their capacity to work and to earn their incomes. Since the 90s, we estimate that heat exposure led to the loss of 42% more hours of potential labor in 2022. And when we look at what this turns to in terms of income loss, we estimate that the global potential loss of income rose to $863 billion in 2022 alone. As you can see on the graph in the right, these losses are not evenly distributed. And the burden as a proportion of GDP falls most heavily on low human development index countries. Again, climate change exacerbating global inequities. And what you can see there in red is the agricultural sector. Agricultural workers, highly exposed to the elements, with little chances to protect themselves from the heat, are bearing the brunt of the biggest losses. And this has an impact not only on these workers, but also on their food productivity and of our economy as a whole. And looking then at food security and undernutrition, we're seeing through an improved indicator that the higher frequency of days of heat waves and of drought months in 2021 as compared to earlier decades is now associated with 127 million more people reporting that they're experiencing moderate or severe food insecurity. These are people that have reported they couldn't access the food that they needed to meet their dietary needs. And we know that as food insecurity rises, so do the risk of malnutrition, with potentially permanent health impacts, especially on young children, impairing their development physically and mentally. These are just some of the impacts that we're seeing in our report. But there's many more, and I invite you to explore a bit more findings. We're seeing extreme weather events increasing in their frequency, particularly lethal extreme weather events increasing in their numbers and frequency. We're seeing also infectious diseases spreading and the environmental conditions becoming more suitable for the transmission. And we're seeing climate change ultimately undermining the very pillars of our physical and mental health. And the impacts are growing rapidly. But despite this, we're still lagging in our implementation of adaptation measures that are essential to protect ourselves today from the risks that we're seeing today at 1.14 degrees of heating. Only in 2022, we saw that just 70% of countries reported at least a high level of implementation of health emergency management capacities, which are mandatory under the legally binding international health regulations. Only 70% of countries have implemented these essential capacities to protect our health. And once again, if you look at the graph on the right, the implementation is unevenly distributed, with low and medium human development index countries lagging in the implementation of these essential capacities, leaving them more vulnerable to the impacts of climate change, and once again, risking to widen our global health inequities. And when we ask through surveys, many of which the WHO enrolls, why that is, why these capacities and other adaptation measures are not being implemented, what we hear by and large is that they're limited by a scarcity of resources and of funding. And looking at just the Green Climate Fund, one of the biggest funders for climate action, only 18% of the funds that they dedicate to adaptation projects support projects with potential benefits to our health. That's only $205 million, which means that we're not supporting adaptation for what matters to us the most, that is our health and the health of those that we love. And this is just at 1.14 degrees. But we're now heading towards almost 3 degrees of heating. This could be just a very early glimpse into a very dangerous future. For the first time this year, we've done projections of our risk and impact indicators. And we're saying that even if we limit global mean temperature rise to 2 degrees, already by mid-century, we would see all of the indicators that we're monitoring increasing in the risks enormously. We expect to see a 370% increase in yearly heat-related death of adults over 65 years of age. The labor hours lost due to heat exposure could increase by 50%. And we could see over 500 million additional people experiencing moderate or severe food insecurity due to the increasing heat waves alone. We could see infectious diseases expanding geographically and being more likely for the transmission. Only at 2 degrees, this would be an unbearable future. We need to take urgent action to limit the hazards that our health systems are exposed to and increase our capacity to adapt and to cope with the risks posed by climate change. Urgent mitigation is absolutely imperative to ensure that climate-related hazards do not exceed the capacity of our health-supported systems to adapt. And each ton of carbon dioxide and greenhouse gases that we continue to emit worsens the health outlook for us and for generations to come. But when we look at what's happening with our emissions, the news there are not positive either. When we look at the energy system, the biggest single contributor to greenhouse gas emissions, we see that carbon dioxide emissions from the energy system have increased by 0.9, almost 1% in 2022 alone, and that they reached record high levels that year. WMO report today shows that we have once again reached record high levels of concentrations of greenhouse gas emissions in our atmosphere. And when we look at the adoption of clean energy, renewable energy, which is essential to phase out fossil fuels as we need to do, we see that although it's growing very rapidly, the adoption of clean renewables, it is still very, very low. Today, clean renewable energy makes up only 9.5% of all global electricity generation. And once again, when we look at what happens in countries with different levels of human development index, we see that the adoption is very unequal. We see that by and large, it is the very high human development index countries that are leading the way in the adoption of these clean technologies, in this new economic development, whereas low human development index countries are lagging with only 2.3% of their electricity being now produced from clean new renewables. And why does this matter for health? This means that people are still burning dirty fuels. Around the world, 66% of all household energy still comes from the burning of dirty fuels, 31% from the burning of biomass, and 35% from the burning of fossil fuels. And again, looking at different human development index countries, we see big inequities. Low human development index households still rely heavily on the burning of biomass. 92.4% of households in this country will still use biomass against 7.5% in the very high Human Development Index country groups. This means that we're still burning air polluting fuels, and that has an immediate and enormous health toll. Dirty fuel burning contributed to almost 2 million deaths from outdoor air pollution alone in 2020. And if you look at the graph on the right, we see that, for example, in power plants, this has come largely from the burning of coal, a very dirty fuel, and today not even a cheap fuel. When we look at households, again, the burning of biomass comes out as the main driver of household-driven outdoor air pollution. And a new and improved indicator this year, we're now looking at what happens inside the homes of people in 62 countries. And we see that because of the burning of these dirty fuels, the air quality is very toxic inside their homes. People are breathing toxic air in their homes. And that is leading to 140 deaths per 100,000 inhabitants. This amounts to millions of avoidable, unnecessary deaths every year due to our persistent use of dirty fuels and to our delay in the adoption of the clean renewable energies that we urgently need. Once again, we're seeing that it is the most vulnerable countries that are being left behind in this zero carbon transition, that remain reliant on dirty fuels and exposed to the health harms of also energy poverty. But the most concerning thing is that we're accelerating in the wrong direction. Last year, the 2022 report said that our health was at the mercy of fossil fuels. What this year's report shows us is that we're even worse today. Looking at the 20 largest oil and gas companies around the world, we see that their plans today would lead to their share of emissions exceeding the targets of the Paris Agreement by 173% in 2040. This is 61 percentage points more than last year, when they were on track to exceeding by 112% the levels compatible with the Paris Agreement. This means that throughout the last year, they have expanded the oil and gas production plants even further, putting our collective future at risk. This year, for the first time, we look at who is financing this transition. We know that the transition to clean energy will be mostly funded by the private sector. So we're now looking at what private banks are doing. And we see that since before the Paris Agreement, average annual lending from private banks to the fossil fuel sector has increased, reaching now $572 billion US. This is since we signed the Paris Agreement, where we collectively agreed on tackling this problem. We're still financing fossil fuels. And looking at the 40 biggest private fossil fuel lenders, 52% have increased very enormously their lending to the oil and gas sector, as you can see on the graph on the right. And obviously, we're also looking now at the governments and what our countries are doing. And in an update from this indicator, we're looking at the net fossil fuel prices through net value of subsidies and carbon prices that countries are allocating to fossil fuels. And we see that out of the 87 countries that we reviewed, which contribute to more than 90% of all global greenhouse gas emissions, 78% still had a net negative carbon price in 2020. 78% of these countries were still effectively subsidizing fossil fuels, oftentimes using public resources, taxpayers' money. And the amounts that they allocated in 2020 reached $305 billion. This was at the midst of the COVID-19 pandemic, when our health systems were crippled and on their knees by an acute health emergency. And we still allocated that year $305 billion US to subsidizing the fossil fuels that are threatening our future. As a proportion of their health budgets, we see that 30% of countries allocated the equivalent of more than 10% of their total health budget to subsidizing the burning of fossil fuels. These are all very grim news. and we're clearly not on track. There's a lot more that we need to be doing. But this indicator report, we also see a few signs of what that better future could look like if we took action to tackle climate change today. We know that health-centered climate action, putting people at the center of all our climate policies, can still deliver a prosperous future for us all. One of the things that we find in this year's report is that employment in the renewable energy sector has increased by 5.6% in 2021, reaching a record of 12.7 million employees. This matters for health because these are new jobs that give way to a clean, healthy economy and that give a way forward to better livelihoods, to cleaner jobs, and to improved economic determinants of health. And when I told you that private banks have increased their lending to the fossil fuel sector, we also find that private banks have increased enormously their lending to the green energy sector. Lending to the green sector reaches now $498 billion in 2021. This is almost equal, just slightly bit under, the total lending to the fossil fuel sector. We still have a way to go, but we need to increase this level of lending for renewables, for clean energy, to deliver a healthy future. And we're also seeing that some of our actions to tackle our emissions have already rendered enormous health benefits. The global death that we can attribute from air pollution that comes from the burning of fossil fuels have decreased from 1.4 million deaths in 2005 to 1.2 million deaths in 2020. And in analyzing the reasons, we see that 80% of that reduction was thanks to reduced air pollution from the burning of coal. We still have a huge way to go. We have 1.2 million avoidable deaths from fossil fuel burning alone. But this shows us the enormous health benefits that could come from that transition. And we're also seeing that international organizations are increasingly engaging with health as a core component of climate change. And we see that a record 22% of the total tweets of international organizations mention the health co-benefits of climate action. Those co-benefits that are enormous drivers to deliver health today by tackling our emissions. That reached the 22% in November 2022. And in the lead up to COP28, we're hoping that this will rise even further. Our data shows us that a thriving future still lies within our reach, but we're absolutely moving in the wrong direction. We urgently need to course correct as we lead up to the first health COP. We need to ensure that we drive with ambition, determination, and that we call for the actions that need to occur today to enable a livable future. Looking at our data this year, we put together 11 core priorities to deliver a healthy future for all. First and foremost, we need to accelerate our mitigation efforts. We need to tackle our emissions, and we need to phase out fossil fuels as a core imperative to ensure that the hazards we will be facing don't exceed our capacity to adapt and to keep on protecting our population, our health supporting systems. We need to prioritize those actions that maximize health gains through cleaner air, healthier diets, more livable cities, increased exposure to urban green space, and reduce energy poverty. We also need to promote the health sector's leadership in delivering this transition. That the Health Day at COP28 is a starting point. We need from the health sector to deliver those public health interventions that also have benefits for our environment by promoting healthier diets, by promoting stringent air quality guidelines. And by decarbonizing our own activity, we still contribute to 4.6% of all global greenhouse gas emissions. We could reduce those emissions, and that would have ripple effects to the 10% or more of the whole global economy that we have control over. We need to absolutely and immediately accelerate our adaptation efforts because lives are being lost today and the damage is irreversible otherwise. And we need to transform our financial system, stop subsidizing fossil fuels, and promote subsidies for health-promoting sectors. For example, the clean energy sector that could also help reduce energy poverty, could deliver cleaner air, could improve our quality of life. financing better the health sector and other health supporting activities to be able to face the hazards of climate change. And of course, increasing our resources and support to continue expanding the knowledge base. We need to have better monitoring systems to understand where the vulnerable populations are, how we can best cater for their needs, and how we can best deliver health-centered climate action. And with that, I will just mention that the Lancet Pathfinder Commission will be launched soon on the 21st of November. So I invite you to look into that because they will be exploring a bit more the evidence on the path forward to deliver this healthy future. And with that, I thank you all very, very much for your attention. And I thank particularly the Lancet for about a decade of this partnership, and of course the Wellcome Trust for the funding, without which we wouldn't be able to do any of this work. And I wanted to thank also, obviously, the High-Level Advisory Board, the Scientific Advisory Group that contribute to the Lancet Countdown, and more than anything, the 114 authors that have contributed to this year's report and that work tirelessly to produce these annual indicator reports every year. Thank you so much. And back over to you, Tulip.
Dr. Marina Romanello, thank you so much for taking us through all of that. Some very stark figures there, aren't there? I think the one that sticks out to me, an 85% rise in heat-related deaths for over 65s since the late 90s. That's a big jump. And it can feel quite overwhelming, can't it? Especially with everything else going on in the world at the moment. And for the same reason, it can feel like there isn't the global headspace to deal with this stuff. But as Marina so clearly referred to there and showed us, that we probably don't have much of a choice, and there needs to be movement in the right direction as opposed to the wrong direction, as her report showed. We also, of course, heard from her about those 11 very specific things that can be done, she argues should be done right now, that would actually leave us in a much healthier, in a much better place, us, and of course, the health of the planet. So some really interesting insights, and I know the 100+ scientists and experts that worked with her, along with a number of different agencies and organisations, worked very, very hard over the last year. So thank you very much, and thanks for going through all of that. We are getting some comments in the question box. Please do keep them coming in. I've got a couple here. This is from Peru, Raul. Hello, Raul in Peru. Lovely that you're here. Raul is highlighting the interconnected nature of climate change and health, which is, of course, absolutely the case. And we're already seeing lots of questions on the role of the private sector, the finance sector, and policy change, which I'm sure we'll be able to get to more later on. Do keep sending in your questions in that box, as I say. Also, if you're on social media, Twitter or X or whatever it's called now, or any other social media, you can use the hashtag LancetClimate23. Now, as you no doubt know, the Lancet Countdown, as the name suggests, is published every year in the very prestigious Lancet Medical Journal. So let's now hear from its editor, Richard Horton, who is hosting the panel discussion for us this afternoon. Richard.
Thanks so much, Tulip, and hello, everybody. Yes, my name is Richard Horton from The Lancet. It's great to be with you again. As Marina said, the 8th consecutive report that we've had the privilege to publish from the Countdown. And you'd expect me to say this, but I really think this is the best report the Countdown team has produced. Not just because of the results on the 47 indicators, but also the narrative around it, the priorities and recommendations that the report gives, and the analysis that the report delivers in terms of the deceleration of action, political commitment on mitigation. This report, to me, is the very best of melding top-rated science with powerful advocacy. And it's a really gripping read, I can tell you. But we have a fabulous panel to talk about the report and to give their own interpretations of the report's findings. I'm going to introduce everybody first, and then I'm going to give everybody the opportunity to give a few minutes of reflections from their particular perspective about what they've heard so far. So let me introduce our 5 stars for the next 45 minutes. First of all, Desmond Appiah is the Clean Air Fund country lead in Ghana. Welcome, Desmond. Dr. Georgiana Gordon-Struan is the Lancet Countdown Small Island Developing States Regional Center Director. Welcome, Georgiana, and she's also Director of the Tropical Metabolism Research Unit of the University of the West Indies. Great to have you with us. We have 2 Dr. Marias with us today. We have Dr. Maria Guevara, who is Médecins Sans Frontières International Medical Secretary, and we have Dr. Maria Nera, who many of you will know. She is the quite brilliant WHO Director of the Department of Environment, Climate Change and Health. Welcome to both of you. And last but not least, we're very pleased to have with us Dr. Catherine Tunn, who is the co-director of the Lancet Countdown Europe. You see how the Lancet Countdown is regionalizing very successfully, and she's also research professor of air pollution, urban planning, environment, and health. So welcome one and all. And Desmond, I'm going to start with you first. Give us a few minutes of your personal reflections about what you heard from Marina, please. Off you go.
Thank you very much, Dr. Norton, and then thanks to everyone and to the Lancet for the invite to Clean Air Fund to be part of this countdown. I think one of the stark aspects that I kind of took from the presentation was the numbers, especially the highlighting of the inequities that exist in the global north and global south when it comes to the impact of climate change and also of on health. If I think about the reference to the heat, increasing heat, and I think about Ghana and Africa, and knowing that the temperature in Accra in Ghana has already, since the 60s, gone up by over 1 degree Celsius. But not a lot of information available to indicate the health and economic impact, but a lot more conversations on the climate impact. I think it's quite stark and humbling. But it also highlights the importance of why we need to be able to focus quite a lot of attention also on Global South, because as I mentioned in the presentation, the vulnerabilities in Global South is quite stuck, and our systems, the existing systems to be able to manage and handle the negative impact is also very limited. And so for my first observation, that was the most crucial. And then also the bit about the funding. If you look at the impact on air pollution, for instance, I mean, I'm from Clean Air Fund, so I would be going there to think about the impact of funding available, the numbers affected in terms of household pollution and outdoor air pollution. I think it's also quite revealing and will be able to help us in the work that we're doing. So those would be my initial thoughts.
Thank you very much indeed, Desmond. Yes, the point you make about more attention to the Global South, one of the findings that really leapt out for me was the massive knowledge inequity. So if you look, the report documents very clearly how when you look at the number of publications coming from different regions of the world, Africa is not up there with the most productive areas in terms of attention being given to the impact of the climate crisis. And yet, as you say, the Global South is the most vulnerable regions, represents the most vulnerable regions of the world. So we have a real problem in terms of there's inequity in action and inequity in knowledge as well. Let's turn to Dr. Georgiana Gordon-Struan. Georgiana, please.
Hi, thanks everyone, and thanks for this opportunity. So I am representing small island developing states, and for me, the things that jumped out at us was the theme of this presentation and of this particular report, which is primarily that we're going in the wrong direction. And as you all know, small island developing states are at the brunt of this climate crisis, and we have contributed maybe less than 1% to global emissions. So the inequity is one of the things that jumps out at me. Also, what has jumped out at me is the health impact of climate inaction, looking specifically at health-related mortality, looking at heat. For us, we have had the highest number, and I'll tell you, it's 103 days for the year on average of health-related threatening heat. And that has so many different implications for us. It has implications for our food security, for water security, for our labor capacity. And if you think of 103 days, that's more than a third, or just about a third, certainly more than 25% of the 365 days of the year. And it makes me wonder what that exposure will have for us in the long term. The other aspects that have jumped out at me, and it is also the suitability of infectious diseases that this new heating of the globe has presented. And for us, tropical infectious diseases, many of them are climate-sensitive diseases, dengue fever, for example. We're having an outbreak in dengue fever right now in Jamaica as we speak. And when we look at the history of dengue fever, in the 1990s and 1980s, we'd have one outbreak per year. And now we're having one outbreak every 3 to 4 years. And that pattern is seen among the Pacific Islands as well. So that is also a challenge for us, and that jumped out at me. I wanted to make a comment about extreme events, and it's a hopeful comment, but it's also a sad comment. And the hopeful comment is that we've managed to reduce death from extreme events. And this has been done because of an integration of all the different agencies and having a better disaster management plan, of people heeding the warning and the warnings going out in time for heeding. And also because I need to give credit to our meteorological tracking for some of the events that can be tracked, like tropical cyclones and hurricanes. So we actually get a chance to move out of the way before, or to prepare ourselves prior to this happening. But I want to bring your attention to Vanuatu. Vanuatu had 3 tropical cyclones within 7 months. The last tropical cyclone was on October 25, 2023, and it was a Category 5 storm. Prior to that, on the 1st of March, they had 1 cyclone, and by 5 days later, within 1 week, they were hit with 2 cyclones back to back. So one of the issues I feel like for states is that we feel like we're constantly recovering. And a lot of the funds that are allocated for us and are hard to access. Marina spoke about the Green Climate Fund. We have to look at how we manage those funds and how those are distributed. There must be another way, a simpler way, an easier way, which still holds fiduciary management in check to help us to access some of these funds. And so I think those are the things that initially came out to me. Those are the things that I reflected on from the perspective of a small island developing state.
That's fantastic. Thanks very much indeed, Georgiana. I'm glad you mentioned dengue. It's interesting, if you track the progress, so to speak, of the decline and burden of infectious diseases around the world, it's indeed true that one's seeing, not including COVID-19, reductions in mortality from infectious diseases over recent decades. But the one disease where we are not seeing reductions in mortality, or actually seeing increases, is indeed dengue. So it's a real concern. The arboviruses are a real concern here. So thank you for emphasizing and underlining that. Let's turn to Dr. Maria Guevara, who, as I mentioned earlier, is the MSF International Medical Secretary. Maria.
Yes, thank you. Thank you, Richard, for this question. But also, I wanted to take this opportunity to first thank you and the Lancet once more for championing the importance of ensuring climate change and health are definitively linked and monitored, and for recognizing actually the work that MSF has been doing on this front. We have been contributing to the Lancet Countdown with our own briefs since 2018, really highlighting the impact of climate change on the populations we serve, and really highlighting also that it's not only will be, but is already being borne disproportionately today by the most vulnerable population. In the field today, we are painfully aware of this compounding effect, and we witness this on a daily basis. As I've said many times already, and even just yesterday in a trilateral symposium at the UN Palais, as a medical humanitarian organization working in the hardest to reach areas for the most vulnerable and marginalized populations, today's climate hotspots are the same as the humanitarian hotspots, and they continue to be blind spots for the rest of the world and black holes for investments. And so the number is on the limited investments that is being placed on those most vulnerable and ones most needing it is really, really stark, especially when they are the ones seeing the losses and damage today because of lagging mitigation and adaptation investments. Every single day of inaction means increasing resilience and increasing emergencies. And in 2022, we actually saw this compounding polycrisis situation, especially the triple threat of conflict, climate change, and COVID. And our medical operation volume has just gone way above 800 projects over 85 countries. It's today 930 projects plus more. And we are definitely seeing those outpatient consultations jumping up to 30% from one year to the next, 16 million just in 2022. We are seeing doubling and tripling of malnutrition cases, from severe acute malnutrition, as well as moderate acute malnutrition, definitely linked to the food insecurities that's compounded even with the conflict situations that we know, especially in Niger, Nigeria, and Chad, as well as DRC. Chad is one of the countries that we've highlighted in this brief. As highlighted as well, flood responses are massive. We know, and we've heard about Pakistan and the impact of that, but that leads to significant disease outbreaks, and cholera outbreaks is what also dominated for us in 2022, but not only. Dengue, as already been mentioned, is one of those diseases that is absolutely not going down, and it's really expanding. And on this, we highlighted Honduras in our brief as well, where we have been responding to at least 7 dengue outbreaks since 2010 and trying to pilot innovative methods to try to control that. And lastly, malaria numbers have also doubled. And now, just in 2022, we've treated 4.2 million cases. We also highlighted that and the work that we're doing with regards to anticipatory action on malaria and predicting better where those things can be. We see that, and it certainly matches all the indicators that's been highlighted in the Countdown report, whether that's the food security with 127 million more people experiencing moderate severe food insecurity, or the, as we mentioned already, the identified transmission potential for dengue growing by 28.6%, or the coastline suitability for Vibrio, for example, and this is reflected in the cholera outbreaks, or the suitable areas for transmission of Desmodium falciparum. So that's also the high risk of malaria, and that's probably, if it goes unmitigated today, climate change that is, then we will probably go to more than 38% increase in this. So thank you for this opportunity to share our insights on this.
Maria, thank you so much. We're extremely grateful for all the work that MSF has done in this area, and it's a real honor to be a partner with you in this work. Let me turn now to the World Health Organization's Dr. Maria Neira. Maria, great to see you again.
Thank you, Richard. So nice to see you again. And thanks to give the WHO the opportunity to be a key contributor to this report. We are extremely happy. And personally, I've been participating to many of them, so very, very happy. Let me start by Tedros keeps saying all the time this sentence that you heard already, that the climate crisis is a health crisis. I think we need to now put another target as well, saying that the climate action is definitely a very, very powerful health action as well. So, and what this important report is telling all of us today is that what I will call the no excuses. I think that we have data, we have analysis, we have trends, we have even positive actions, we have even reasons for hope, so no excuses. And this is why the COP28, WHO, together with all of you, this report is extremely, extremely timely to make sure that no one among the negotiators that will be representing our countries at COP28, they will leave the meeting in Dubai saying, we didn't know, we didn't have enough data, we didn't have enough indicators. You never present the case with all the scientific evidence needed. This is out of question. The evidence is very strong. We are all moving on a very strong message together, from Médecins Sans Frontières to academic world to WHO institutions, groups, NGOs, civil society, name it. There is a very strong agreement that climate change is having devastating impact in our health. The other message we need to take to COP28 is all of those health arguments for being more ambitious, more quick as well on the reactions we need to do, and telling the negotiators as well that they shouldn't think that they are negotiating exclusively about CO2 or sources of emissions. They are negotiating how many cases of dengue we are going to have, how many cases of increase on cholera cases or outbreaks are we going to have, how many cases of asthma, COPDs, respiratory are we going to have, how many deaths are we going to have of caused by air pollution. So all of that tell us to the argument of using health as the big, big motivator for more action, making sure that no one will have the excuse of not investing on climate change and health. This is the other thing we need to fix. We need to fix the energy, access to renewables, fix the lack of financing for health, fix the access to clean, renewable sources of energy at our healthcare facilities, reduce dramatically the number of deaths caused by exposure to air pollution, and all of that, we can do it in positive, using the health argument to mobilize all of this huge community. Big, important day in December at COP. A lot of expectations, and we hope we can leave it with a strong commitment by the countries that things are going to change. Thank you.
Thanks so much, Maria, and thanks for bringing us to COP28. I'm going to ask each of you in a moment to dive deeper into what our hopes and expectations are from COP28. But before we do so, let me welcome again Dr. Catherine Tan, who is the co-director of the Lancet Countdown Europe. Catherine, your immediate reflections on Marina's presentation.
Yes, well, thanks so much, Richard and Marina and others for the invitation to be part of this panel. I think this is an extremely powerful report. And I think what really strikes me from this year's report is this message that they're absolutely going in the wrong direction. I think there's, in many instances, not enough awareness of just, that we have many emission reduction goals, we have other policies in place, but what this report really clearly shows is that despite these quite positive targets, what's actually happening on the ground is going in the wrong direction. I think we see that when we're looking at the greenhouse gases have still not peaked. They continue to increase. I think it's very striking when we look at the extent of the fossil fuel subsidies. So this value of $305 billion US in terms of the net value of fossil fuel subsidies. This is, if anything, a very clear indication that we're going in the wrong direction. Again, what Marina was talking about in terms of the production plans for fossil fuel companies, that their projections for the next few decades involve a significant expansion of the fossil fuel supplies. Again, going in the wrong direction. And I think we also see this when we're looking at the really inadequate pace of mitigation. What we see in this report is that, limiting temperature increase to 1.5 degrees. The sea would require an annual growth in in renewables 13 times what we have now. So yes, it's increasing, but the pace is just far too slow. Similarly, we see quite a significant increase in sales in electric vehicles, but the reality is that fossil fuels still account for 95% of road transport energy. So while I think that message of going in the wrong direction is very powerfully conveyed in this report, what I particularly like about this report is the focus on the quite concrete actions that we can take. We know what to do. As Maria Nero was saying, the knowledge is there. We know what steps need to take. And I think this list of the 11 priorities of how to deliver a healthy, thriving future is a really powerful part of this report. It makes it very clear what the key priorities and next steps are. There are very concrete next actions of what we need to do. Number one, remove subsidies for fossil fuels. Change our urban and transport planning to make active and public transportation the first choice for getting around our cities, increase access to clean, reliable energy through distributed renewables in places that currently have big barriers to clean, affordable sources of household energy, and other really important targets for health co-benefits like our food system. So 30% of greenhouse gas emissions coming from our food system. There are very concrete recommendations of how to shift to more plant-based diets to promote health and meet nutritional needs at the same time. So it's I think a really important report and document, and I think particularly this focus on concrete actions. This is what we can do. Is I think a really exciting part of the report this year.
Thanks very much, Catherine, and. I just want to thank everybody watching. We're getting lots and lots of comments and questions coming in, so thank you for staying tuned with us. Please keep doing so. I want to dive into COP28 now, and the report presents COP28 in two distinct ways. The first is to welcome the fact that there is a specific core theme of COP28 on health. It shows that the evidence about health and the climate crisis has been growing in credibility, and it's really quite an important breakthrough politically to have health as a core theme at COP28. But it also gives a warning, and the warning is the danger of health washing. The United Arab Emirates is not exactly a neutral country with respect to fossil fuels, and there is a real concern that the whole of COP28 is going to focus on adaptation and dodge the bullet, so to speak, about mitigation. And in terms of health diplomacy, there's been some evidence that participants have been cautious about pushing mitigation messages, knowing that the UAE will not particularly welcome those. So I want our panel now to think about the outcomes of COP28. What do you hope to come from the meeting? What will success at COP28 be for you? And let's start again with Desmond.
Yeah, thank you very much. And I think success from my point of view and from Clean Air Fund's point of view, will be seeing clear commitments from governments in tackling air pollution, because there are also clear co-benefits for climate. I mean, if we look at Accra, for instance, the key sources of air pollution are also the key sources of greenhouse gases, which is the energy, transportation, and waste management. And so if we look at it from the air pollution angle and say we are putting health at the center and tackling this because we are seeing the cost to the economy and to health and to people, that we need to focus on it. But we are not getting the level of commitment from governments to put it at the center. We are seeing also, and other panelists talked about the data and availability, and clearly in this part of the world, the localized data is not available, and so we need to be able to be driving the data argument, bringing the evidence, localized evidence, to be able to drive that kind of policy commitments that we want to see from COP. We also need to get clear commitments on funding. I mean, if you look at the level of funding that comes to Global South when it comes to, say, air pollution, and I'm using air pollution because we are clearly at Clean Air Fund trying to show that there's a clear linkage between tackling air pollution and the impact on climate and also on health. And so if we're able to have those commitments and be clear about it, if only 5% of the funding that goes towards air pollution is coming towards Global South and Africa in particular, 5%, which is less than $1 billion of the funding, yet there are about 30 times or 36 times more, according to a report that Clean Air Fund released last year, of funding that is going to fossil-based investments. And so there is a huge disparity, and we want to see governments at COP to make the clear commitment to say we want to be able to look at cleaner sources of energy. We want to see the investments going to cleaner sources so that it drives down the knockback that we are seeing from fossil-based emissions. Then we want to be able to get that kind of commitment moving into action. There are clearly, say, in Ghana and in other African countries, we are not seeing clear actions. In places where there are even laws and regulations, they are not being implemented to the letter for us to be able to say, because we've implemented these actions, this has been the benefits. We are not seeing it. When we have blocks, like economic blocks, like the ECOWAS bloc, for instance, that have made commitments to say reduction in fuel, sulfur in fuels, we do not see the full implementation across the bloc. So you see one country just do it and it's kind of left. And so besides the commitment to investments in clean energy that we want to see and reduction in the commitments going to fossil, the investment going to fossil, we want government to be able to drive these commitments and see action. I think if we're able to get these from COP, I think that would be a good plus, a big positive for us to be able to track and support the work that we're doing.
Thank you very much, Desmond. That's great. Georgiana, COP28, opportunity or health washing?
A little bit of both. I believe a little bit of both. So for me, I think for the 6 nations, last COP was a success for us, because even though it happened at the very last minute, we were able to get agreement for the loss and damage fund that we've been negotiating for a really, really, really long time. Right now, it's still on a bit of a rocky ground, as you know. They're still in negotiations, but it is my hope that at COP28, we will have some solid commitment, just as Desmond said, for this fund and for how this fund will be managed and how it will be useful. I also wanted to just jump on other aspects of COP. I want our governments to negotiate a data system especially small island developing states, data systems that will help us to better manage and better predict and do more research on the impacts of climate change on health in our own countries. So more funding is needed. And I also wanted to echo the call of the World Meteorological Association for more integration of meteorological data into health data, and so that we can develop better early warning systems and early response to our health crisis.
Thanks very much, Maria. And let me turn to WHO's Dr. Maria Neira. Maria, this has been a tricky diplomatic line to navigate, hasn't it, coming up to COP28?
It has been a long road, and it took us more than 10 years to reach the position that we have now on incorporating health, at least having a health day. But this is an historic day. Of course, we need to make sure that everybody will hear about our arguments, and as I say, that nobody should leave COP saying that they didn't know. That will be already a big achievement for us. But don't forget that it's not only the Emirates that the ones that are negotiating. We have almost 200 countries negotiating. So we need to make sure that those countries are the ones that realize that if they don't take ambitious decisions on reducing emissions, drastically reducing emissions, on stop giving subsidies to fossil fuels. And it's incredible that the health the voice of the health professionals is the one that needs to remind them that they need to stop this nonsense of giving subsidies to fossil fuels. For us, first of all, is a balance, is adaptation and mitigation. So be absolutely reassured that WHO and all the partners and the voice of the health professionals that in the number of millions will be backing up us at COP is both. It's about mitigation and it's about adaptation. But we need to put pressure in all the countries. So each of us, we have a member state who will be negotiating. Those are the ones we need to influence. Because as you rightly say, having a health day is a nice political moment, but we are not yet into the negotiation process. So my personal desire for the COP will be to enter into the negotiation process and making sure that they have in the negotiated text something about health. And something means stopping give subsidies to fossil fuels, incorporate adaptation funds to make sure that we respond and we save lives, and do massive reduction of emissions in order to reduce air pollution and the 7 million deaths associated with that, and stop this damage that we are causing to and ensure all of those transitions. So COP29 has to be, health needs to be at the negotiation table, not just on a health day. So we keep the ambition very, very strong.
That's fantastic, and a very clear message about the importance of getting mitigation in there, and a very clear outcome goal from you, Maria. Dr. Maria Guevara, from MSF's perspective, what will be success at COP28 for you?
Thank you. So just a reminder, so I said that we've been contributing to the Lancet Countdown in 2018, and it's also the same time that we started to actually get engaged at the COP. And at that time, health was on the sidelines. It wasn't even in the center. So this is an amazing opportunity with all the work that's been put in that we actually have come to a health day. But as already been said, it needs to not just stay there. I mean, as we've also noted in this Lancet Countdown report, the trajectory is just worrying, of course, especially as a medical humanitarian organization. If we don't do something about it and mitigate this as well as adapt to it, we will be in deep climate, health, and humanitarian crisis. So from the perspective, also from my personal perspective, having been engaged here and also at the COP, we really need to ensure that health is first and foremost at the center. We should look at healthy as the new normal and health as the new wealth. Health and well-being must and should be the rudder by which we navigate, and that should be at the negotiation table. So that is one success. The other is that the other day that is next to the Health Day is this Relief, Recovery, and Peace Day. For the humanitarian actors, this is important to also continue to shed light on this, and especially for the most vulnerable, clearly recognizing that and giving that a voice, because we cannot tolerate any more blind spots, any more black holes, especially for the support and investment needed for the most vulnerable populations and countries affected today. I think a third success is going back to really detoxing from our addiction to fossil fuel to stay healthy. In the words of Dr. Tedros, we need, I was recently learning around the just boundaries as opposed to safe boundaries of climate change. And that just boundary is at 1.0 degrees, and we've surpassed that. So unless there is a real commitment to fossil fuel phase out, which I know is a high bar for this COP, but that really needs to happen. I think our voice as the health community needs to push on that public health imperative, but also on that moral obligation that we all collectively have a responsibility to act. And we are here in attending COP28 in solidarity to the vulnerable populations around the world, with this only opportunity they have to on speaking around climate and really pushing the issues on the table.
Very good.
That's what I hope.
Thank you very much, Maria. Absolutely. And Catherine, success at COP28.
Well, in my personal view, success is that high bar where we are getting very concrete and ambitious timelines on how we're going to transition away from fossil fuels. But I think really what I would, hope for in this is, I think echoing many of the comments that we've heard so far, is that health argument is there in the negotiations, that it's not just talking about the cost of mitigation. That's not the whole story. The whole story is, we need to talk about the health co-benefits of mitigation, the huge public health savings and the economic valuation of those health savings that we have from lower levels of air pollution, from healthier diets, that completely change the accounting of climate change mitigation. That needs to be part of the discussion. It's not just about the costs of mitigation, and just very much that it would be I think really disappointing to see the emphasis placed exclusively on adaptation in this COP. Basically, where our current policies put us on track for nearly 3 degrees of warming by the end of the century. Adaptation to this level of heating is going to be extremely challenging and costly. We're already struggling to effectively adapt to the 1.1 degree of warming that we have today. It's going to be almost impossible at that level of warming. So I think it's really an illusion to think that we can adapt our way out of this without mitigation.
Thanks very much, Catherine. Absolutely. I think that's a clear message from the report and from the panel. Now, we've had lots of questions coming in from our viewers, so I'm going to give some quick fire questions to the panel, and you just need to jump in and give your answer. So this is going to be a bit anarchic, as it should be. So, Dr. Tedros declared a public health emergency of international concern when it was COVID-19. Why isn't the climate crisis a public health emergency of international concern? Why aren't we declaring a public health emergency to really kickstart commitments and actions, which you've all said is important, by governments? Who's going? I'm going to pick on somebody if you don't say. Maria Neri, you're smiling.
I suppose I'm the one, yes. We definitely, this is all the time in our minds, and it has been requested even by many editors of scientific journals, and this is an option. Now, you need to think that, of course, there is a panel that needs to request that. It's not WHO. There will be a panel of experts that will advise WHO and WHO's Director General. But there are several considerations. This is probably a crisis that will require a long term, and maintaining all of this interest on the long term and an acute response by the international community will be something that we need to put on the balance. Second, there is an international panel, which is the IPCC, the UNFCCC, that are the ones that are leading with. So definitely for WHO, this is an emergency and has been declared as a public health emergency long time ago, and we will keep repeating it. Now, whether it's a public health emergency of international concern with all the characteristics, that's another discussion that, of course, is on the table.
Very good. Thanks, Maria. Anybody else want to come in on the idea of fake? All right, we're going to go to the next question. All of you have said that we need to phase out fossil fuels. That's a very worthy objective and very easy to say, but none of you have said how. So how are we going to phase out fossil fuels? That's what our viewers want to know. So your answers, please. Yes, Maria, other Maria.
Thank you. I think for MSF, that was one. We have 3 pillars of action actually around climate and health in our action. It's operational adaptation, environmental footprint mitigation, and obviously the advocacy aspect. And the first thing that we did was actually challenge ourselves on doing no harm to the environment and having the unintended consequences of our own actions in the field. And we have committed to this to decrease or half our carbon emissions by 2030 compared to our 2019 levels. And we've done collective road mapping of each part of MSF to really see where we can do that. From the offices that we're running globally, but also in our project. And we're trying to innovate across the board on what we can do, but in a way that is also working and adapting at the field level, using mitigation as an adaptation tools to respond to actual emergency. So weaving all this together, answering to real-time humanitarian action. Much of the big carbon bubble that we need to attack first is actually in the supply. And so we're really looking at how to do that better, but also how do we use alternative energy sources. And this was also highlighted in a brief on creating the solar panel deployment emergency kit that we can even transport in the back of motorbikes. When we do actually deploy a facility or whatever, we are able to use alternative energy sources. Unfortunately, we are limited also with what is available in the larger social society. So that is what we need to push for.
Very good. Thank you, Maria. Thank you. We've only got a few minutes left. Did I see somebody else want to comment on? Yes. Maria, did you want to go? Oh, hang on. Let me see Desmond. Desmond, go on. How are we going?
All right. Thank you.
Phase out fossil fuels?
Yeah, I think there is the need to build a stronger local case for the impacts of other methods of development patterns. If we take, in our case, in Ghana and Africa, I think that we have a massive scope for development, and the need is there. But if we continue on the business as usual path of development, then we would be having the negative impact. But there is opportunity. Evidence is clear. The science is also clear now that the alternative methods of going on that development path would give us the benefits, which would not be continued 36 times investment in fossils, but rather a reduction and looking at the alternatives. Just one example, we want to improve transportation. We want to be able to move goods and services. One way is to go on the traditional path that we've seen other countries go on. What about looking at the alternative ways of transportation, introducing more green transportation? So just a simple example like that.
Oh, that's very good.
Yeah. All right,
very powerful example. Right, we're going to wrap up now, and I'm going to give each of you no more than 30 seconds to give a final message to our dedicated viewers who have been hanging on your every word. And I'm going to start with Catherine.
So I think I would just close with this idea that there's so much that can be done, and we really know already what the key actions need to be. And I think many of them are highlighted in this report. And it's when really this idea of ambitious mitigation opens enormous opportunities to address, to improve public health, address inequities in access to clean household energy, and there's a role for everyone here. We don't have to wait for governments to act. There are actions that local authorities can take, organizations can take, like we just heard about MSF, and also individuals. Individuals can choose their mode of transport, they can choose what kind of project.
Okay, that's great. It's not somebody else's problem, it's all of our problems. Marinera, please, final reflection.
A couple of things. No excuses, as I say, but no regrets either. No regrets. We are asking people to invest on something which is common sense, and health will be the big, big winner of this.
Fantastic. Thank you. Maria Guevara.
So climate crisis is a health humanitarian crisis. We need to make sure that we use health and well-being as the rudder to which we navigate and respond to today.
Thank you very much. And Georgiana.
So I just want to say that we're going in the wrong direction, but there is hope. And with that, there are lots of opportunities. We need to look at the inequities that exist and try to address them, especially the inequities around access to renewable energy for people who are more vulnerable.
Thank you, Georgiana. That's wonderful. And Desmond, you've got the almost last word from the panel.
Thank you. I would mention that we need to build collaborative partnerships to address the challenges, ensure that there's strong evidence base, especially in areas that data is not available, and also to ensure that we build inclusive decision making to be able to achieve our goals. Thank you.
Fantastic. Thank you very much. And let's, on that final note of inclusivity, let me hand back to Marina and thank our wonderful panel. Please give them a virtual round of applause for what they've done this afternoon, this morning, this evening, wherever you are watching. But Marina, back to you.
Thank you so much, Richard, and thank you so much to all the panelists for those wonderful interventions. Thank you, Richard, for keeping it exciting. So I'm just going to share with you now some of the other products and other exciting things coming up from the Lancet Countdown. So if the slide text comes up, there we go. Yeah, just a few things that I wanted to share with you before we wrap up. First of all, as you will have heard, this is not about research. This is not about scientific publications. This is not about keeping things locked within a scientific paper. We want to get this evidence and ensure that it does indeed drive action and that it's useful for those that can influence our policymakers, that can spread the news, and that can ensure that we tackle this health crisis that is the climate crisis. So for that, we produced, as we've done in previous years, policy briefs together with our key national policy partners that you can see on screen, and together with an enormous team of authors who I thank enormously for the work that they've put into putting these policy briefs together, each of them drawing on the findings of our report and contextualizing it on the realities of their countries to help lead the way forward to what actually needs to happen to deliver climate action for health. And this year we have a new product that is this 17 data sheet. There are data sheets that draw on the key findings of our report, that there are 2 pages, very short, very snappy, which we hope can be used and picked up to then produce your own policy recommendations for everyone to be able to access our findings at a national level. More policy briefs will be coming up next year as we launch our regional Lancet Countdown reports, and I'm going to tell you a bit more about that in a moment. I also wanted to draw your attention to our data platform, which is online, it's freely available. There's 47 indicators shown there. and they can be explored at a national, subnational level, and a much greater temporal resolution that you can in the report. So if you want to find out more, do explore our webpage. Is lancetcountdown.org, and there you can find much more resources. And as I said, this is the global launch of the 2023 report, but it will be followed by a series of regional launches driven by our regional centers, as well as national level launches. And in these events, you will hear a lot more about our regional findings, which, as I said, are in the report, and our country level findings. And you can see when these events are happening, look for the one close to you. They will feature local speakers, very exciting, contextualized findings as well. And you can find much more about this at lancetcountdown.org. And importantly, we're launching today the global Lancet Countdown report. But as many of you will know by now, this is one of the many products of the Lancet Countdown. The Asia Lancet Countdown report, focusing in China, will be launched in a couple of days. And we will have the other regional reports being launched in April. These reports will be launched ahead of the UNFCCC negotiations in the intersessionals, where we can have influence over what happens in defining the upcoming cycle of negotiations. And alongside these reports, we will have more policy briefs, country profiles, and other sheets that we can share to help drive action with the local context that is what really, really matters. And we've heard a lot of questions, and we generally have this conversation with many of you about representation at the Lancet Countdown. Many of you will know that the Lancet Countdown is entering a new phase as from next year. And a key area of focus of this new phase will be to increase our representation. We're hoping to be able to open our Africa Center next year. And we will also have new opportunities and new positions to be covered within the Lancet Countdown. And we invite you all to visit our webpage, to follow us on Twitter, and to keep up to date on our latest announcements, because we will be putting out calls for key positions within the Lancet Countdown very soon. We're hoping to attract and to engage with those researchers in areas that we have underrepresented so far at the Lancet Countdown, particularly low-middle-income countries. I heard a bit also about Africa. We really hope to elevate those regional perspectives within the next phase of Lancet Countdown. So do follow us there. And I'm hoping that in upcoming years, we can have a bit more of a global representation that we critically need to tackle climate change, which is a global issue. And with that, I just wanted to thank you very, very much once again for joining today. Thank you to all the panelists, and thank you to all the contributors to the Lancet Countdown. And without any further ado, I will pass back on to you, Richard. Thank you.
Thanks very much, Marina. Now, Tulip's going to do the official close of this presentation, but I just have a few quick remarks to make. I said at the very beginning that this is really the best report ever from the Lancet Countdown, and I really sincerely mean that. But I want to say why this report's important. It's not important because it's just another publication. This is the only independent accountability mechanism that exists on our planet for health and the climate crisis. And that's a really, really important reality and fact. What does accountability mean? There are three elements to accountability. The first is science-based monitoring, and that's what this report does absolutely brilliantly. But it's more, accountability is more than simply monitoring. The second part of accountability is creating a mechanism for a democratic, participatory, transparent review of those data, so that you can have a global conversation about what those data mean and what we're going to do about them. And that's what COP28 can provide a crucible for, that participatory, transparent, democratic discussion about the data. So that's why we published the report just in advance of COP28, so we can influence and shape the debate. So the health-themed day that we have in the UAE is indeed a breakthrough and really important for that. But accountability isn't just monitoring and review, it's also the third part, which is action. And if you don't do something about what you're monitoring and what you're talking about, if there is no action, then there is no accountability. So we really have to think about how we up our game as a health community. As a health community, we have been trained and educated to think scientifically and not necessarily to be social actors or political actors. But we really need to think how we take the diagnosis of this dysfunctional, collusive system that we have that has decelerated action and how we change that, how we accelerate action, how we alter the trajectory that we're on. Because in some countries, we are seeing small c conservative forces and sometimes big C conservative forces lead reversals on commitments to net zero. I'm speaking to you from London, and I'm afraid that my country, the United Kingdom, has implemented and instituted policies that will see us dilute our actions towards net zero. So this argument is never won. This argument needs to be made again and again and again, using the very best science as a platform for screaming to the international community that the evidence is telling us that we are on a path to planetary destruction, and it is all of our responsibilities to act to change the direction that we are currently on. Now, I want to look ahead just for a moment to COP, because this year we do have this unprecedented opportunity. We've never had that before. And when you signed up to this event, you were asked to give your hopes for this health COP. And I'd like to share some of the answers that we have been given. Number one answer from all of you is that word action. And we need to take action if we're going to save ourselves from the destiny that is being written for us by fossil fuel companies, governments, banks, financing institutions that are in this collusive process. So action number one, and we have to think about what we do to translate these fine words in this report into action. Number two, knowledge. And this is a really important word. Knowledge is not just something that sits on a shelf or in a book. Knowledge is a tool. It is an instrument to accelerate political change. So let's think about how we use the knowledge that we're creating. That was the original idea of the Enlightenment 300 years ago, and we've forgotten it. So let's remember how important knowledge is for accelerating progress in society. The third word that you emphasized was about integrating health into the climate negotiations. You heard that from our wonderful panel. We need to go from a health day to seeing health in the negotiations. Maria Neira emphasized that in what she wanted. And then finally, we need to deal with the elephant in the room, and it's going to be one massive element in Dubai, and that is fossil fuels. And we need to, the most important action we need to take is going to be on fossil fuels, and we need to get them out of our lives now. So we have to think about how we get these dreadful, dreadful poisons out of our existence. And we in the health community have a special voice, because if we are anything at all, we are there to defend public health. We are there to defend the futures of those who we signed up to be responsible for. So our voice should be the voice not just of ourselves, but of the public, of our patients. So these hopes that have come out of what you've given us today on action, knowledge, integrating health, and eradicating fossil fuels, they highlight your energy and your commitment that you're bringing to COP. So thank you for that. We hope that we've been able to give you some of the evidence that we are so proud to publish, giving you insights that can provide that platform for the advocacy that you are going to do. But the challenge is enormous. So let's remember what we mean by health. Health is not just another lobby group. trying to get the ear of governments. Health at its most fundamental level is about everything in our lives that's meaningful to us. Health is about the people we love, the people we care for, our friends, the land we live on, our history, our future. Health is the most precious idea that we've created because it is about something fundamental, life. It's about life and the future of life. So action means going beyond just talking about universal health coverage and health systems. It's about the political, the environmental, the social, the economic, all of those conditions that make our lives worth living. That's what health is about. It's what makes our lives worth living. That translates into things that are very practical: the clean energy for your home, the food to feed your family, the ability to work without being out in harmful conditions and being exposed to infectious diseases. So health, very simply, is about life. It is about those you love. And so when we look to COP, when we think about what we're trying to achieve, keep those words in your mind. Life and love of your friends, your family, and this planet. And now I hand back to Tulip. Thank you.
Many apologies. Thank you, Richard, for that very passionate end to what has been an incredibly insightful and interesting couple of hours. Life and love, that's a nice way to end any gathering together, isn't it? So we have come to the end of today's event. I hope you have found it insightful, inspiring, and that you feel like you're further armed now with the latest science and evidence around health and climate, as the people who make these big, crucial decisions get ready to meet in Dubai next month. As we heard there from Richard and our panelists, the hope is that no one's going to be able to leave Dubai saying that they didn't know the sort of impact that climate is having on our health. And as we heard there from Richard, the hope is that this is translated into action, a word that many of you have written when you talked about, what you wanted to get out of this, and action which leads to change. That is the overall hope from many of the people on this call, on our panel, and so many of you. So thank you to our keynote speakers. Thank you to the authors of this report for all the hard work, the hours, the blood, sweat and tears that has no doubt gone into this year's Lancet Countdown. And thank you so much for watching, to you all over the world, and for your excellent questions. I'm sorry we didn't get to all of them, but we will, I think, try and be in touch and answer some of them afterwards. As Marina mentioned, the Lancet Countdown has upcoming regional events, and you can find out more about those at lancetcountdown.org, or click on the link in the resources panel to find an event near you. To end today's event, I think I'll leave you with the words of the UN Secretary General Antonio Guterres, who wasn't involved in writing this report, but he has put out a statement responding to the information in it, and I shall read it to you now. The continuing expansion of fossil fuels is a death sentence to millions. There is no excuse for a persistent delay in climate change, in climate action. Temperature rise must be limited to 1.5 degrees Celsius to avert the worst of climate change, save millions of lives, and help protect the health of everyone on Earth. Thank you.